Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guest on the program is Dr. Michael Ukaegbu. He is a general practitioner here in Lake City working out of the Lakeshore Primary Care West organization. We're going to talk to Dr. Ukaegbu and when we come back talk about internal medicine and health ailments that you may have or you may get. We'll do that when we come back.
Oh, look, a redhead.
Staring contest.
You still got it.
I know.
Come alive with the forest.
The dad was cute.
You were looking right at us.
Visit discovertheforest.org to find a forest near you.
Welcome back to Perspective here on Florida Gateway College Television. My guest on the program is Dr. Michael Ukaegbu. He is an internal medicine physician.
That's
and
correct.
He also is a general practitioner here in Lake City. Welcome to the program.
Thank you, Mike. Thank you very much.
And welcome to Lake City. You just moved here in March of this year.
Yes, we just arrived with the new kids on the block.
New kids on the block. Well, you and I were talking before we came into the studio about what your practice is. Tell us a little bit about what you deal with. Is there one particular health issue that you see more than others?
Right. Well, thanks for having me on your show. I'm an internist by trade. An internist is the adult doctor. We see patients from age 14 to 99. We are the gatekeepers in healthcare. We take care of almost all the medical problems you may have, from your diabetes, your uncontrolled hypertension, your heart failure, and several other ailments in internal medicine.
So you're kind of the manager of, if you've got a issue with hypertension, it's not something that just goes away. You manage that with medication and exercise, or what are some other things that you do as a manager?
That's right. Healthcare entails, we don't only do medication, we also do play an advisory role. We bring to forefront what's as salient, what the patient needs to know to avoid to do at home, like eating salt, for example. A lot of salt in your diet will affect your blood pressure. So part of our goal is to, while we optimize the medication for these ailments, we also ensure that we're able to communicate effectively the kind of lifestyle adjustments a patient needs to make to achieve the goal.
Doctor, you talk about people doing away with salt.
Right.
That's tough for some older folks to I mean, part of your managing of their medical condition is convincing them, correct?
Right, absolutely. Like I always tell my patients, I will not tell you to completely abstain from what you normally love to do. But what I usually advise is everything in life in moderation. If you're going to eat salt, try to cut back as much as you can. But it's well documented that salt plays a very strong role in making your hypertension, your blood pressure go up.
Now, no two patients are the same. That's why they call it a medical practice, because you're practicing to make sure that each patient is responding differently. Is that a challenge? Is that a good challenge in medicine?
Well, it's a huge challenge, but that's why we're trained to do what we do. You try to understand that, like you rightly said, Mike, every patient is quite individualized, very unique in their own respect. So it's our role as providers to look at the patient and look at your particular situation and address care around those very unique circumstances that the patient has.
Dr. Michael Ukaegbu is a general practitioner here in Columbia County, Lake City. He works through Lakeshore Hospital Primary Care West, and we're talking about health issues that folks, as they age, we all experience health issues. So let's talk about one of the biggest health issue, and that is obesity. And tell us why obesity is such a terrible thing, because it's so many other things happen because of it.
That's correct. Yes, I'm glad you brought that up, Mike. Obesity has a handprint in almost all the medical issues that you have, name it from heart disease, your hypertension, kidney disease, eye disease. All this have to do with cholesterol that rises up with obesity. So it's been well documented that if we're able to control obesity, we'll have a way of trending down on the incidence of these other medical problems. So our goal as primary care providers is, as we advance care, we also try to bring to forefront the need to exercise, to cut back on the weight, the incidence of obesity, and hopefully in achieving that goal, would have also achieved the goal of reducing the incidence of these other medical issues.
It's difficult for some folks to lose weight. And would you say it's not just diet? I know people who diet and then they gain the weight right back.
Right.
Diet and they gain the weight. It's kind of a cycle that they go through. Is it really a change in your life to eat right, to lose weight, and to maintain?
Well, to some degree, will require some commitment on your part to recognize that if you're obese, there are things that need to change. Now, I agree totally with you that it's so difficult to change a habit. But what I always advise is I have this rule, I call it the rule of halves. You can start from there. You can say to yourself, if I eat a bowl of cereal a day, I can cut back on that by half. If you eat a bowl of pasta, cut that by half, because it's well known that you gain weight by what you put in. Although we are aware of some people who have a genetic disposition where, like a friend of mine used to say, he says, all I have to do is look at the food and I get big. And some people don't eat at all, eat a lot and they don't get big. So there are people who have those genetic dispositions, like I mentioned earlier, but the truth is that weight gain comes from what you eat and also the outputs, how much exercise you're able to do, because it's in, you take in the calories, and out the exercise, the energy you put out. So if you don't put out much energy and you put in through food, what the body does is it has a very brilliant mechanism where it stores all these calories as fat. So it's important to cut back on what you eat and increase your exercise outputs, and you'll see the weight loss.
Has society just, you got to have it now, fast food? It seems like, and your colleague Janice Watson and I have had this discussion on many occasions, it's harder to eat right.
Right.
Because you have to buy the fresh vegetables for salads. You have to buy fresh fruit, and sometimes that doesn't always stay as long as you'd like it to, but it's good for you.
Right.
Versus the processed food that a lot of people eat, and it just goes to sugar and makes fat.
That is so true. And also, we factor in, we have a busy, we're in a different world now where everybody's on the move. You barely have time to sit down to eat a proper meal. So we rely on fast foods, like Mike, you mentioned, and these foods are rich in calories. And factoring those together, we'll have to selectively watch what we eat, and also exercise our output is very important.
Let's talk about some issues that occur, and we mentioned diabetes.
Right.
Diabetes is more cruel, I think, a disease than people realize. Talk about the complications of diabetes.
Right.
Not just that your blood sugar is high, but other things happen to you when you have diabetes.
Right. So diabetes is one of those diseases that has what we call a systemic manifestation. It affects your eyes, it affects your heart, it affects your kidneys, your nerves. It causes what we call peripheral neuropathy. So it's one disease that we really, really pay a strong attention to trying to control it, because if you do not do the right thing, if you have diabetes, those complications will come very early.
Well, let's talk about why does it cause problems with the eyes? Why does it cause? Is it because the blood is not getting, because of the sugar level in the blood?
Right. Because of the high level of sugar in the blood, sugar, their molecular states, have what we call crystals, and these crystals lead to blockages in the small vessels that supply blood and oxygen to the eye. So over a period of time, there's destruction of these nerves, and this blood vessel line leads to what we call diabetic retinopathy, which is the #1 cause of blindness here in the United States.
So diabetes is a cruel disease. It affects so many different things. It can cause heart problems because the same reason, because the blood is not getting to all parts of the heart.
That's correct. Your heart needs oxygen. The heart muscles require a high level of oxygen. And again, all those blood sugar crystals, they block the blood vessels. They also cause, the body is able to convert excess sugars into cholesterol plaques that line up these vessels and block them over a long period of time and cause heart attack because they prevent the supply of blood and oxygen to the heart.
Let's talk about heart disease as well, because diabetes can cause heart disease. You can have hereditary heart disease.
Right.
You can have heart disease by smoking.
Right, absolutely.
There's so many things that you can, your heart is what keeps you going, and when you abuse it through other, if you're going to smoke.
Right.
Talk about heart disease. You see patients that have heart disease,
right,
and you treat them again according to what they present when they come to see you.
Right. Absolutely. What you mentioned, Mike, is the lifestyle, the risk factors: smoking, obesity, hypercholesterolemia. All these are the major risk factors that will determine if you're going to have heart disease or not. So what we try to do is we try to optimize what we call your lifestyle. If we believe that if we can prevent some of these risk factors, reduce our risks, that your chances of ending up with a heart disease will be greatly reduced. So you see patients, the classic heart disease patient is a smoker, is obese, and we try to zero in on these risk factors and advise them accordingly in terms of reducing the risk factors.
So say I'm a smoker and I'm having chest pains. What are some things you're telling me to quit smoking, first of all, correct?
Right. Well, the reason that's important is because it's been well documented that smoking affects the integrity of the the walls of the blood vessel. So for us to be able to really help a patient who has heart disease, we have to modify those risk factors. Absolutely, smoking is well known to worsen those symptoms.
Losing weight?
Losing weight, of course, like we had mentioned earlier, in losing weight, you reduce the cholesterol plaques, and in doing so, freeing the walls of the arteries from blockages.
Now, exercise is also an equation in
Right.
maintaining someone who has heart disease. What do you recommend when they exercise? Do you recommend them going to a gym? Do you recommend them doing some cardio on a stair climber, or typically what do you say?
Well, I'll tell you from a personal experience, getting to do an exercise requires a lot of commitment. So what I advise at a minimum is that the patient should do what they're able to tolerate. What are you able to tolerate? If you're able to go to the gym, that's beautiful. If you can go do some cardiovascular workout that increases your heart rate, helps you burn those calories that you need to burn. Now, there are some people who really don't have the time to go to the gym 3 times a day. Such people, I recommend, if you have a Stairmaster like you mentioned at home, or even if you have your neighborhood park where you can go from time to time. Walking around, speed walking, increasing your heart rate, sweating is very good because it helps burn those calories that you need to burn.
Does it also help reduce cholesterol by exercising?
I'm glad you bring that up. There's a component of cholesterol that is called the good cholesterol. Now, the good cholesterol is important in reducing your cardiovascular risk because what it does is it acts like a cleanser for your arteries. It pulls out the bad cholesterol, all those plaques, takes them to the liver where they're broken down to harmless residues. So it's well documented that exercise is the only remedy that unilaterally increases your HDL, which is the good cholesterol.
Now, as a general practitioner, you see a lot of heart disease, you see a lot of diabetes, you see a lot of folks that are obese that are potentially going to be in trouble if they don't do something about their weight. But you also see someone who may have a hernia.
Right.
You also see someone who may have pancreatitis.
That's so correct.
So is there another disease that you see a lot of outside of heart disease?
Oh, absolutely. We see, like we mentioned earlier, the role we play in healthcare is we're the gatekeepers. So we see basically everything that comes through. We see your hernia, we see your pancreatitis, chronic obstructive pulmonary disease, COPD, which is due to prolonged smoking, like we mentioned earlier, uncontrolled hypertension. So our goal is to be able to identify these problems and make the necessary determination at the time the patient comes through the door and try to filter through and see those who require referral to other specialties, and that's what we do.
Do you, I think a lot of people look at doctors and they look at the TV series House, where everything is so difficult. The cases are all. Do you see those rarely, where you have a question where a consultant needs to be brought in and see just exactly what the problem is? Oh
yes, you see that every day, and that's what your training guides you to be able to filter through problems when they come through the door and make a determination at the time of presentation. You ask yourself, is this patient such that medical management will take care of this problem, or do I need to refer this patient to a specialist? That's part of our training, and that's what we do.
You do a lot of referrals to? I'm assuming that if you've got someone who's got diabetes and they have problems with their eyes, that their vision is going, that you recommend them to see a specialist so that problem can be taken care of.
Right. Diabetes by protocol, by our standard of care, diabetes patient needs to see an eye doctor once a year. And the reason is just to keep an eye to make sure that that patient is not developing one of the complications of diabetes, which is diabetic retinopathy. So what we do is when I see a diabetic come in, I try to ensure that they get the proper care that they deserve, which is to make those necessary referrals to the eye doctor, to the foot doctor to check for possible neuropathy in the extremities. And also to keep a close eye, ask about symptoms, and make a judgment whether I need to refer this patient to the heart doctor or not.
So that's a good thing that, unfortunately, there's problems that occur because of diabetes that there are specialists that need for every part of the body, just about.
That is
true.
true.
Talk about COPD. You see a lot of that here. I know that society is now frowning on those who smoke, and it's become more of a bad thing. But there are still those holdouts that continue to smoke.
Right.
Is there a treatment for COPD except just stop smoking?
Frankly, the treatment for COPD is to stop smoking. Every other treatment we have is just to minimize the symptoms, to help the patient breathe. So it's well documented that if you smoked for a fairly good time, stopping smoking may, and I emphasize on may, leads to reversal of the damage that already has been done. However, not many patients are lucky in this regards. There are some that are past that point where it becomes irreversible. So I agree with you totally. The only remedy, the only cure for COPD is to stop smoking.
Now, it's never too late, right? I mean, some people who've been smoking for 25 years or 30 years say, well, nothing's going to change. I might as well just keep smoking.
Right.
What's your response when they say that to you?
My response is that each time you light up that cigarette, just think about it. Each time you light up that cigarette, you're destroying cells in the lungs. So stopping smoking helps preserve those cells that are already not destroyed. So I totally agree. It's never too late to stop smoking, because the earlier you stop smoking, the earlier you start saving those remaining cells in the lungs that you need.
I'm going to ask you sort of an opinion question. WebMD, self-diagnosing.
Right.
Is it helpful, or do people need to come see you?
Well, I'm thankful that you brought that point. It's a good thing that the patient is able to go to the web and look up some of the things they think they need to know. But the problem with WebMD is it generalizes. All the information out on the web is a generalization of the problem. It's not specific to the patient. So it's important for the patient to see their healthcare provider so that their individual cases will be noted and care will be directed to fit their peculiar situation. So while it's good to be knowledgeable to some degree regarding what you think you have, it's important also that you follow up with your healthcare provider who has much more knowledge in tailoring care that is peculiar to your medical problems.
Do you see some people go on the WebMD and they self-diagnose and, oh my God, I'm going to die because I know I have this. And then they come to you and you do a blood test, or you do a urine test, or you do some kind of test, and you say, not really.
Right.
Do you see that a lot?
Absolutely, I see that a lot. And such patients come back to you and they're very thankful that, that they came back to be reassured that they really didn't have what they thought they had. So again, as much as WebMD is okay for general knowledge, but you should take it with a grain of salt, recognizing that whoever is the author of the material you read on the web doesn't know who you are. But guess what? Your primary care physician knows you and will tailor your care according to the peculiar situation that you have.
Can you work yourself into a panic attack? I mean, have you seen that I'm dying, doctor?
Yes.
I've only got 3 months to live, and
Right. There are, actually, it's a medical condition. There are some hypochondriacs people who just feel they have all the problems in the world. And again, it's our role as healthcare providers to reassure people like that that their fears are not real.
Let me ask you, we're getting close to the end of the program. Drugs ads that are on TV. I mean, I look at the COPD ad where the elephant is sitting on the woman's chest, and do you find that helpful, or are patients coming to you and say, why don't you just put me on that and I'll be fine?
Right. Some of the ads are helpful. Some of the ads bring home some of the things we hone in our individual offices. But the truth is that not all the medications you see on TV will address your individual problems. So again, that's where your healthcare provider comes in. We look at you, we look at your medical presentation, and we try to put together a care plan that fits your unique situation.
You taking new patients?
I'm taking new patients, absolutely.
Now, your practice is west of Lake City and
Right.
on Stonegate.
Primary Care West.
Primary Care West, which is past the interstate.
Correct.
You've got 2 nurse practitioners
I have
in your practice?
2 nurse practitioners who are well educated, very knowledgeable, who are in my practice. They supplement care there. They work along with me, and together we have over 30 years of experience in taking care of patients.
So if you'd like more information about Dr. Ukaegbu, his address is 221 Southwest Stonegate Terrace, 101. The number is 292-7744. And if you have any questions about what we've talked about, the nurse practitioners in the practice can answer any questions. If you'd like more information about how to be a patient of Dr. Ukaegbu, you can call that number as well. Great to have you in Lake City. Thank you for being on our program.
Thanks, Mike.
And thank you for watching Perspective here on Florida Gateway College Television. Until next time, I'm Mike McKee. We'll see you.